Hello, everyone, and welcome to the May installment of our virtual C-Dubs Classics presented by Kaiser Permanente. C-Dubs Classics provide monthly health and wellness activities to Santa Cruz County residents. I'm Cody Allen. I'm the Game Operations and Events Manager with the Santa Cruz Warriors. And today I'm joined by Rick Galvan, Kaiser Permanente Santa Cruz County Psychiatry Clinic Manager, and we will be discussing mental health and wellness as part of May's Mental Health Awareness Month. Rick, first of all, thank you so much for joining us.
Thanks for having me.
Before we dive into the Q&A, can you just give the viewers a little insight to your background and kind of your day-to-day role?
Sure. So my background, I'm a licensed clinical social worker. So that means I'm just licensed to be able to practice psychotherapy in the state of California. I've been a psychotherapist for about 27 years, I think 28 this year. 7 of those years have been with Kaiser Permanente. 5 of those 7 have been as the manager for the department here in Santa Cruz County. And then on a day-to-day basis, I'm actively seeing patients. I'm doing direct care, in addition, of course, to just my administrative responsibilities just as being the manager. So it's an honor to be able to serve our local community here.
That's great. And yeah, so to kick off the kind of question and answer portion, for you, what is mental health?
Mental health, for me, is kind of one of these intangible things. In fact, probably for many people, this sort of like confluence or convergence or interplay of basically like our thoughts and our feelings and our actions, right? Or our cognitions, our emotions, and our behaviors. And of course, mixed in with just our overall, social well-being. These are the things that kind of influence and dictate how we perceive ourselves and our worlds and how we interact within it. So hopefully, ideally, these are very, very healthy functions for people.
Yeah, definitely. And kind of going into the other side of it, what are some root causes of mental and or behavioral health problems?
Sure. I think with a fair amount of mental health problems, there is a biological component to some of these things: clinical depressions, clinical anxiety disorders, things like OCD, conditions like schizophrenia, bipolar disorder. These are even ADHD. These are conditions that have a biological component to them, which is why oftentimes medication can be a very, very helpful intervention for those types of conditions, because there's something in the kind of nature part of things. Things like substance abuse also don't help along the way. But then also, things like traumatic backgrounds and painful life experiences can also contribute to people developing some mental health problems, especially if they don't have like adequate, social support. So it's kind of that coin toss between nature versus nurture. Again, biologically speaking, definitely a foundation there, and the kind of the lives that we've led and been exposed to, they can also contribute to mental health problems. In addition, just to kind of like everyday, stress and some unforeseen stressors and how we respond. So it's a pretty wide open field for the opportunity for a mental health problem.
Sure, and with that kind of wide openness, for those individuals that think they may be suffering from a mental health disorder, are there any signs or symptoms that typically pop up?
Sure, I think with mental health conditions, with mental health disorders, they can be like many medical problems where they might not be so obvious. The signs or the symptoms might not be so obvious at first. They can be rather subtle and can sneak up on us. I always try to encourage people to really pay attention to just some of those basic things like, how well are we sleeping? What is our sleep hygiene like? Are we sleeping adequately? Is there a change in our sleep pattern? And then other things like our appetite, are we eating more than normal, less than normal, and just how well we're taking care of ourselves, our personal care activities like grooming and hygiene. These are those sort of like core basic daily activities that, can sort of first feel the waves of a mental health problem. And, sometimes we ourselves, again, might not notice them, but people that are close to us, people that know us well, people that love us, people with whom we have a great deal of trust, might begin to notice stuff and maybe, share comments or observations. And, having the courage to kind of take note and take in, their feedback can be a very, very helpful thing to do when, trying to prevent or catch some sort of mental health problem before it's too late.
And with that, say those symptoms pop up, there's an individual that wants to improve their overall mental well-being. What are some steps that you would suggest to them?
Sure. I think, again, just kind of taking care of those kind of basic ABCs, they're the basic fundamentals, sleeping right, eating right. But then kind of like going beyond that, being as social as we can, catching a Warriors game, catching a C-Dubs game, like these are normal, human activities that make us feel good. Again, kind of laying off excessive alcohol consumption or drug use also is a prudent idea along the way as well. And maybe trying something new, getting outside one's bubble, getting outside one's box, and taking some courage and being able to maybe fail a little at something in life. These are the things that can only make us stronger and more resilient.
And given the past 2 years, I feel like we've seen a lot more of an emphasis put on mental health and trying to dive deeper into that field. Can you talk about how things have changed during the pandemic?
How things have changed, I would say like quickly, and then slowly, and then quickly again. I'm joking, but it's been change all the way around, right? There's no way around that. I think the biggest change that in the mental health field that we've experienced has been in how we deliver our mental health services, meaning, the entire world has gone virtual. I mean, look at us now, right? The entire world has gone, video or telephone or virtual. That's been the biggest shift for us, I think, in the mental health industry, maybe not even just within Kaiser Permanente, but we are now delivering our services in a way that's, not how we went to school to deliver services. I didn't go to school, to learn how to be an online therapist. So what we do, our line of work is hugely dependent upon our ability to make connections with people and to maintain those connections with people. The human element is such an important part of our line of work. And then having to do it in this an online kind of a way, which can seem and sometimes is, somewhat impersonal. That's been our biggest challenge, is how do we maintain that connection? How do we develop rapport? How do we establish trust? How do we help people who are, maybe going through a painful life experience feel comfortable opening up, allowing themselves to be vulnerable and really kind of like be part of this healing process in an online format. So that's probably been our biggest challenge. I'd like to think that we've been very, very successful in that. Again, the whole world has kind of flipped this way. So people have had to practice, something along the lines of radical acceptance, like this is our new world. And it's been embraced, I think, largely by our patient population. Everyone's carrying a cell phone or some sort of electronic device kind of anyways. A lot of people have found it more convenient in that regards. And so while the pandemic has just added stress and anxiety and worry to people's lives, obviously that's another change that we've seen, kind of like more anxiety and stress and worry than perhaps we've ever seen before. Our ability to sort of help people cope with that has largely been influenced by our ability to adapt electronically and virtually. I think also, improving our ability to help people manage anxiety and manage worry, that's been a big part of what we've been doing in mental health over the last 2 years as well.
Awesome. And I'm sure you would be the first to say that mental health awareness should be something that's looked at year-round, but can you talk about the importance of May being Mental Health Awareness Month?
Sure, right? Every day should be Mother's Day, every day should be Father's Day, every month should be Mental Health Month. I totally agree. I think in the mental health industry, in the mental health field, we have fought very long, very hard for something called parity, right? We want mental health conditions to be treated and viewed just as importantly as hypertension and diabetes and other, major medical problems. And so by having a month dedicated just to mental health, I think really sort of legitimizes us as a problem area just as much as cancer or any other major condition. And hopefully it helps to destigmatize mental health, and that allows people to seek out treatment and seek out help. So I'm really glad and grateful that we have this month dedicated for us, because I think it just really kind of opens up the door to people saying like, hey, this is a real thing, just again, like, cancer or other conditions, and it's okay to get help.
That's great. And Rick, I'll leave you on this one for a viewer or listener that tuned in to our C-Dubs Classics this month. Where if they're looking to learn more about mental health awareness and those items, what kind of local resources are out there to help them get started?
Sure. I've been in Santa Cruz for a couple of decades here, and I'm a huge fan of thinking local first, right? It's a popular slogan around here. And I think that our local chapter of NAMI, the National Alliance for Mental Illness, is probably the best start. NAMI, scc.org, I believe, is the website. But every major county essentially in the country has a local NAMI chapter, and the NAMI provides a lot of free information now online for families, for individuals who are either experiencing a mental illness or are the friends or the family or a loved one of someone who might have a mental illness. And by that, I don't just mean something like schizophrenia, I mean something like even anxiety and depression. And this is information that people can really kind of like digest in such a way that you don't need to have a PhD in clinical psychology. It's very, very accessible, very, very palatable. I think that's the best start to learning more about mental health conditions and how to take care of oneself and one's loved ones.
Well, Rick, a big thank you for joining us and sharing your expertise and insight today for this edition of C-Dubs Classics.
Again, it's an honor and a privilege. So thanks, Cody, for having me back. Looking forward to next year.
Absolutely. And to the viewer, thank you on behalf of the Santa Cruz Warriors and Kaiser Permanente for joining the May edition of C-Dubs Classics and our discussion on mental health today. For more information about mental health and wellness services through Kaiser Permanente, please visit kp.org/Santa Cruz. C-Dubs Classics have activities the last Monday of each month. For more information, visit santacruzbasketball.com/classics. Thank you and have a great day.
Thank you. Bye-bye.